Tonight's call, as you've seen in the chat, is going to be about Impact Health. And we have, I'm pretty sure you know already, a very special guest speaker tonight that's going to cover that topic. Just last week, I had the opportunity of having her and Miss Nicole Woods in town personally. And when I tell you they went over this information in so much detail, it completely changed how we're going to do business in Tennessee, like completely. Everybody was extremely fired up, and we actually have several people that were getting started solely because of Impact Health. They didn't care about any of the other services or the business plan whatsoever, but they were sold on the presentation on Impact Health. So what we're going to do tonight, we're about to revisit that topic. And the lady that's going to give us that information, you all know her background. She's an RVP in the business, a business owner. She has a heart of gold, and she just got back from doing another event, I believe like 2.5 hours away. So she just got home just in time to get on here to share some more information with us about Impact Health. So without further ado, Miss Jocelyn Driskill, are you there, ma'am?
I'm here. So great to see you. I miss all of you in Nashville. That was the best. I will be back. I can't wait.
We look
So
forward to it.
yeah, we had a good time. So that was a poignant moment. I think that's something in time that we'll look back on and go, that's when. Because I heard a lot of goals coming out of that event. So I can see big things happening. And so I was grateful to be asked to come out there. Mr. Clemens, you're such a phenomenal leader. And the leadership that you all had there, incredible, great time spending with them, not just training, but afterwards. It's always the meeting after the meeting that means the most, the connection time. So I love that. And you did something special for us, so I'm so grateful for that as well. So thank you so much for all you did while we were there. And I see Catherine Williams, who was just with me in Modesto, California. Hi, Catherine. Where we had a packed house, right, Catherine? It filled up. New Market, I will tell you, in Modesto, California. In fact, it was literally roughly this month, 15 years ago, Tony and I had our first Saturday training in Modesto, California at this hotel, and nobody even knew it was that. I mean, it was so surreal for me, like very much of a, what would you say, affirmation of what's to come this year that Mr. Thomas has been talking about so much. And be prepared, prepare the plan and get ready and do something big, because ACN is, and so are the leadership. I watched Jeff Weber just nail it in Modesto today, and tears, and I mean, people were just filled. That room was filled up today with the Spirit. It was awesome. So I got to share this same training, and I think when we understand something, then we can really do something with it, wouldn't you say? Like, if you really understand it, and you really can get the bigger picture, and you can understand the value that you're bringing to the marketplace, also the value that you're bringing to your home, right? When it comes to income, because I know it opened Jabri's eyes, and the goal that he made was a huge goal, and it'll impact you residually in a big, 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 big way. It's the largest service, as far as money goes, that we've ever had in ACN for these 31 years. So, but more importantly, it's a gift. We have a gift in our hands, and there's never going to be one to compare like Impact Health. So let's talk about that and really get the details and some nuggets that will help you get excited about getting out there and talking to people. So I'm going to share my screen here. So give me a second. All right. So where do most people go, right? Private self-funded groups. You've heard of some of these private groups like Cigna and Aetna and United Health, and you've heard of Blue Cross. So, people go to what they've heard of before. They don't necessarily seek out new things that could be better for them. So remember that you're bringing something, I would say you're bringing something better and more significant, and something that is disrupting the industry. One of the things I talked about today is, and I'm going to stop share here for a second, is disruption of any industries are big. Think about Uber, right? How many of you would have gotten in a stranger's car before? You wouldn't. But because of the technology, we use it out all the time. I used it all over Nashville, right? So it's the technology that really brought that business to life. What about Airbnb? You're going to go to some stranger's house? Usually not, right? But now that technology of how you book and so forth with Airbnbs and how they're run, people do it all the time around the world. So with the technology that is a disruptor in this space, in the healthcare space, Impact has it in spades. Health sharing has been around for 40 years. It's not new. Okay, it's not new at all, but they have perfected it, kind of like ACN. Do you know how Mr. Greg Provenzano, happy birthday to Mr. Greg P. I forgot, I remembered that this morning that it was his birthday. Thanks for reminding me, Mr. Thomas. So how he talks about, the piece of paper that he rips in half, that they ripped in half when they were creating ACN, and all the good parts were on this side and all the bad were on this side, and they ripped it in half and they took all the good and that's what they applied to ACN. That's what Impact Health has done in the sharing healthcare space. So I want you to really understand how they have really stepped in the forefront when it comes to healthcare. So let's go back to sharing my screen again. Okay, so obviously people work in the government and get health care. There's self-pay, people pay cash, having a job that offers benefits. But I'll tell you more and more today, people are not, businesses are not offering health care. And what happens is they're not keeping great people because they don't have the benefits. True or not true, right? So let's go here. What most people want. What do they want? They want affordable monthly premiums. They want affordable co-pays. They want affordable deductibles. They want to be able to pick their doctors and the hospitals they go to. Employers want to offer healthcare options. It's true. And you can see the statistics over here. Why impact health sharing? Well, solution to the rising costs of healthcare. How many of you love your healthcare? Love your insurance company? How many of you love, yeah, because we're on Impact, right? How many of you love paying the insurance bill? You don't. Let me talk about, give you a story. Tony and I had Blue Cross for many, many years. And we did used to offer it to our employees, and it was very expensive, but it's probably 3 times that now, right? And so what I would say to you, we used to pay $1,900 a month, almost 2,000 just for 2 people in insurance. And Tony and I went searching, and we did find a health share program, and it was in the Christian, it was Christian care ministry. And so it was focused on Christians, and you had to have a church, right? It's specific. That's what most healthcare sharing. You should go back and look yourself where healthcare sharing came from, because it is pretty interesting to really know how long ago and how it was perfected. I will tell you there was a lot of limitations though with the Christian care ministry one, and I know there is with others. There are so much more open doors when it comes to Impact Health, and I want you to really write down and know those open doors that are available so that you're sharing them with the people that you're sharing impact with. So let's go back to here. So delivers a modern and affordable alternative to health insurance. So kind of have to get the idea of insurance out of your head. And when people, if they hear you say, oh, it's healthcare sharing, and they don't hear insurance, people, they always go to what they know, even though they don't love it, right? So you have to be able to have a conversation with them of knowing that the insurance word and the share word aren't that different. It's just, it's the same thing, but we're doing something better, but we just can't call it insurance, okay? It puts the power, freedom, and control for our healthcare options and decisions back in our own hands. And everything in your portal with Impact Health is, I mean, it's all in detail. It's all there for you. You know where everything is going, where your monthly, when you're putting your money in every month, you have a portal that tracks all of that. And when we're sharing it with someone else, they let you know. It's just, there's nothing hidden in Impact Health. We're open to anyone who is interested in sharing and savings on their healthcare cost. So then we talk about comprehensive, what they bring. They bring comprehensive medical care. Again, you can pick your doctor and facility, nationwide, access to all networks. And that's what's important. I can tell you in the sharing program we had before, and even with Blue Cross, we were limited to a network. So we had to choose the doctors. We had to go to a website and choose what doctors in that area would take those particular ones. Not with Impact. You can go anywhere in the US with Impact. In fact, you can go outside of country if you have something tragic or something happen to you, you can use Impact outside of our country, which is also phenomenal. We have unlimited telemedicine. It's 0% provider fees. I just had a gal in the car driving home with me, and she said, I just did a telemedicine with her old. She's going to be moving to Impact, but she did it with an old one. And she said it was $900. That's what they charged her insurance company. That's crazy for telemedicine. The RX pricing is phenomenal. And the one thing that I will say about the RX pricing, you could actually print out what the pricing is on all of the prescriptions that are out there. There's so many, but if somebody's looking to see how much it would be through Impact, you can look it up. It's that simple. I can tell you I had to get an antibiotic last year for the first time after 20 years almost. And it was $3. It was nothing. It's phenomenal. So you'll see that our pricing is very simplistic. Okay, we're going to talk about that here in a second. Starting at $73 for individuals, up to then starting at $378 for families. And we are an alternative and privatized pooled healthcare group, and we are not for profit. See, insurance companies are for profit. That's why they're so expensive. Where do you think all that extra money goes? We won't have that conversation, but I'm going to tell you it's not coming back to you. And that's when anybody's, or the person who has insurance. And that's what we found out. Now, this is what your Impact membership cards look like. And some of you have Impact, so you already have these cards, but very simple to use. I can tell you, if you look here, let me go here, you see where you can see exactly what fee you're going to pay when you walk into any of those places. If you're going to an office visit, you can see it's $50. The MD Live is $0. Urgent care is $75. A specialist is $75. Outpatient service is $75. And ER and inpatient is $150. Most of anything you're going to see across the board, it's more than what we're saying here. If you look at over here in the box with the yellow around it, EDI payer ID, this is how they do the billing. Everything they bill is digital, just like insurance. And so if you knew how insurance was billed, it's all digital form, and they use this EDI payer ID. So any hospital or any doctor's office is submitting your bills, same way they would submit the digital way with insurance. They'll do it right directly to Impact. And it's incredible how this works. And it doesn't feel different to these providers at all when they see. And when they find out how they get paid, the crazy part is they're getting paid anywhere from 10 to 21 days of submittal of payment. Now, I can tell you insurances are not getting paid for 30, 60, 90 days, and sometimes longer. So when they experience how Impact is paying, you're going to see more and more coming on. And we are just at the forefront of really exploding this Impact Health with everyone. So I'm telling you right here, it doesn't highlight. If you look here, you're going to see that right here, this is the pharmacy. So if you take your card in, they're going to input these numbers and letters into their system, and that's what's going to pull up the pricing for your pharmaceuticals. So anyway, how to get a quote. you're going to take get a quote from the oldest in the family. So whoever, like in our household, I was the oldest. And if you look at this, it's what's the birthday of the oldest member of your household? So you would put it in over here. You can see that. Okay. How many members of your household, and then get a result immediately. It will actually pop up. You're going to see this. So September 18th, 1969, and it's for three members of a family. What you can see here is it's a family of 5. It would be about $628. And I'm going to go to the next slide and you'll see that for a PRA, which primary responsibility, that is you're going to see some language that I'm going to talk about, which it compares the responsibility with a deductible. You're going to see how that language works. And that's important to understand as well. So when you look at this, you can see that for $2,500 dollar responsibility, it's $628 for that family. Now, let me give you an example here. Okay, I'm going to give you an example of my daughter and son-in-law. We have 3 grandchildren, so there's a family of 5. So you can see with their primary responsibility, they chose $2,500 and their cost was $628. Well, let me tell you what they were paying. They were with Blue Cross. They were paying $2,800 a month. $2,800 a month. Okay, let me go back and show you now that I see all these faces staring at me going, what? So if you look at this primary responsibility, they chose $2,500, $628. Now for them, they were paying $2,800 for their rate per month. They had a $10,000 deductible and their co-share was 30%. Okay, I'm going to come back here to the screen and look at all of you. They had a 70-30 plan. They had a $10,000 deductible, and yet they were still paying $2,800 a month. When you take 628 from 2,800, what you're seeing is a $2,200 basically savings per month. What is that per year? Do you think that that made an impact on that family, which is my family, right? Yep. It's a lot of money. Some people don't even make that much in a year, correct? So what could they do with that amount of money? They can invest it, right, get a return investment on their money. So that key right there. So when you see that, when you put in someone's birthday and you pick 3, did you notice that it said 3 plus? So anything after 3, they're free. Right? They're free because it's 3. So if you have 5 or you have 6 or you have 7 or you have 10, it's still $628. Is that phenomenal or what? Yeah, they're not adding any extra per kid or anything in the family. So that's one thing that a lot of people don't get when it comes to that. So I want to make sure to point out that, but also when I talk about this, understand most insurances offer 80-20, right? If it's a Blue Cross or something like that, you're going to have a choice of an 80-20 plan or a 70-30 plan. And then you have a choice of a deductible from 2,500 to 10,000. And as you can see on ours, if it's the higher the deductible, the lower the amount. Same with them. But 70-30, tell me what 30% of $100,000 bill is. Because even when they've covered the $10,000, they still got to cover the 30% of the 100,000, correct? And guess what? Insurances don't max out on that 30%. Impact Health maxes out at 5,000. So let me go back to the screen so you can actually see. This is undeniable. When I talk to healthcare people, it's incredible what their faces drop. Okay, so if you look here, you have a co-share. So once you pay your $2,500, right? So you get your bills, and let's say you have a $5,000 bill or whatever. They're going to reprice it for you, so it's not going to be 5,000. You're going to see that next. But let's say it's 5,000. You're going to obviously have to cover your 2,500 on that bill. But then now it goes to the 10, now you're going to pay 10% and impact is paying 90. Okay. Now let's take my daughter's family of 5. When that 10% in that year per home, not per person, reaches $5,000, it's now 100% covered. Everybody get that? You cover your 2,500 responsibility, just like you would with your insurance. You, whatever deductible you have, you got to cover that first. Then the 80-20 or the 90-30 kick in, or 80-20, 70-30, and our 90-10, which I've never seen anywhere, kicks in. You cover 10% of whatever that bill is. Well, when you max out 5,000 in that year, you now are covered 100%. So that means if you have a $2,500 responsibility and you max out at 5,000, you can't pay any more than $7,500, no matter what the bill is. I hope everybody's getting that. Y'all got it? Does that make sense? No? Okay. So that the 10%, so when anybody has an insurance plan, it's either 70-30 or 80-20. And you're going to always have to pay that 30% of whatever bills come into your house. Or you're going to have to pay the 20% of that bill. It doesn't ever max out in insurance. But here, once you hit $5,000 in your household, it stops. And you now are covered 100%. Everybody got that? Okay. That you don't see anywhere. And people miss that part. It is huge to know. So that person who has a $2,500 responsibility will never pay more than $7,500 that year with a family of 5 or a family of 4. It's incredible. Okay. So let me go back to sharing the screen here. Okay. All right. So next slide here. Okay. Language. So there's just some different language when it comes to the share programs because they're not insurance. So actually the primary responsibility here, which is what we're looking, I'm just going to share a couple, versus deductible. It's the same thing. It means the same thing. It's just a different verbiage. In fact, primary responsibility makes more sense, right? It's your responsibility to cover that. Deductible, yeah. So that's the difference with that. If you look at eligible for sharing for impact, or cover or coverage, it means the same thing. It's just said differently. If you look at not qualified for membership, healthcare says denied. Okay, so that's what these look like. You can take a picture of it. These are the slides that they use on Thursday nights, and we'll talk about that in a minute. But this is incredible for you to know and just get to know the verbiage. It's important to know the verbiage. Okay, you don't have to know every single one because you're not always using all that. But anyway, so benefits of Impact Health Share. Impact feels like traditional insurance, even though it's not insurance. Okay, remember that. You can't tell people it's insurance because it's not. It's a share program, but it feels just like insurance. Actually, it's better. We're in the business of cutting costs, not care. And you can choose, you have many choices because you are not limited to the doctors of a network. You can choose your doctors. Not only that, we offer like mental health. People can have therapies, right? So I want you'll be able to go to the guidelines, and all the guidelines tell you that. Make sure each and every one of you though has updated, if you've been in the business a while, your Impact Health Sharing accreditation. You want to make sure that when new people come in, they get accredited. Now, the questions are easy to answer. They're not hard. And I usually walk through with my new IBOs, that accreditation. And I continue to learn that way. So what separates Impact from other sharing programs is the way we manage the billing. And that is the technology that I was talking about. I am not technology driven. I don't understand all of it, but when you understand the pieces like Uber and like Airbnb and that technology that created this powerful this company now that it kind of rules the USA when it comes to Uber and Airbnb, right? It's changed the way people travel. the inclusive desire to help as many people as possible with reference-based pricing. So this is another big key. How many of you know that there is a reference-based pricing list that every doctor and every facility has, that they can go by and use that pricing as reference-based? Like, that's what they should be using. Well, they hike things up, right? And they don't tell you, and you don't know that you can have reference-based pricing. Like, what does that really cost? Have you ever seen a hospital bill that comes in and everything is like labeled the same way, but you don't know what it really is, and then it has a cost next to it? It's very confusing. Well, with Impact, we have advocates, we have a legal team, and they go through our bills and they make sure that you're getting advocacy for the bill that is coming to you from your doctor or from a hospital stay or whatever it is. And I'm going to actually show you on screen what some of these doctor bills look like and what they will be when Impact uses reference-based pricing. So let's look at this bill. This bill came in, and this is a true bill. It was $152,000 for inpatient for what, 7 days, 2/2 through 2/9 last year. 152,000. Who knows what was in that bill and what I don't know what this person had, but if you look at it, Impact repriced it to $36,611.63. That's a huge repricing, because that's what was fair for what this guy or girl had, the procedures and all, and for the stay of 7 days in the industry standard reference-based pricing. Now, this client, this patient paid their copay. When they walked in, they had to pay their $150. And then their primary responsibility that was left was $1,588.76. And then they had the 10% of this bill. Okay. It's 90-10. Once you pay your primary responsibility, you now have 10% of the bill. What's 10% of this compared to this? It's huge, right? So amount that they owed out of their pocket was $5,226.02. What would it have been if it was $152,000? Which most companies are not going to they might reprice it a little, but not that much. And that is phenomenal when you understand how the repricing works, why it works. It's industry standard, so they're not doing something outside of the industry that we're a part of, and people know about it, but we didn't know about it. True? True, we didn't know about it. Now we're being educated, and having the education is smart. So when you go to pre-existing conditions. So let's talk about a little bit about pre-existing conditions, because some people have had some signs, symptoms, testing, diagnosis, treatment, or use of medication that occurred within 36 months prior to membership. Okay, so pre-existing doesn't mean you can't be an Impact customer. It just depends on what the pre-existing is and how significant it would make as an impact on that customer. True? Okay, so let me give you an example. Back in 2016, my husband had an intestinal burst and he almost died. And I have to sit here grateful for the extra 7 years that we got with Tony, because it was a very scary time, February of 2016. Seems like a lot of things happen in February. And anyway, he recovered, but it was 11 days in the hospital. And the thing is if he was on Impact, it would have been covered, right? We didn't have it then. But my point to make here is he had an ostomy bag. He had to wear that for a year. In 2017, it was reversed. And so that surgery was all a part of the same thing, right? In 2017. Now, in 2022, we launched Impact. Because it had been 5 years, anything that happened for Tony, if that happened again on the same side or the same thing, it acts like it never happened because it was outside 36 months. Does that make sense? Okay. Now, let's say somebody's within, like, say somebody has knee surgery, right? There's a pre-existing thing there, signs, symptoms, treatment, that's all. So look at the guidelines. They're very simple. The ethics and their integrity is incredible. So everything is spelled out for you. If they have knee surgery on the left knee, and let's say they had it a year ago and they're looking at impact and they're paying, like my son-in-law, $2,800 a month for Blue Cross. Let's say that. Now, his knee is doing well. He's a year in. He doesn't have any other pre-existing like heart issues or cancer or anything like that. Okay. So he signs up an impact. Well, if something happens to his knee, they're going to reprice that surgery, right? If it's within a year. They can't cover it because it's pre-existing. Does that make sense? But they do reprice it, and I'm going to show you what they did for somebody here in a second that was in that situation. And it made sense for him to be with impact because of, you'll see my example here. But let's say he had to have a knee surgery on the right knee. Well, that's a totally different knee, so it's not pre-existing. Okay, so he had the left one done, but the right one went bad in that 36 months. Well, that's a whole different knee. So that isn't pre-existing. We got it? Okay, so now let's look at guidelines. And one of the things they don't count as pre-existing is high, and I love this, they point this out, high blood pressure or high cholesterol will not be considered a pre-existing condition for purposes of determining eligibility for future vascular or cardiac events. So if you have high blood pressure or cholesterol, or you have a client that's saying they have that, if they come into impact and outside of the 36, inside the 36 months, and they have something vascular or cardiac, it doesn't count. It doesn't count as a pre-existing. Okay. All right. So look at this. So someone who had pre-existing, I think it was a heart condition, got on impact. He was probably within months, I think is what I was told, of being in the 36 months. Well, he had a heart attack or something. I don't remember the whole thing. Well, he was charged $223,858.56. And they repriced it and deducted $209,000 off of that for reference-based pricing. So was it worth it to him to have impact and still have a pre-existing that wasn't covered, but he got the repricing and he got the prescription care pricing as well? And his balance was $14,000. What do you think that would have been with insurance? Well, think about my son-in-law, for instance. All that money he saved would have been better for him to pay the $14,000 than keep paying the $2,800 a month. So you have to kind of break down the scenarios with each person. Okay, there's 91 million people out there that are looking for impact. That is the uninsured, the underinsured, right? And it's really important to see how much value that impact is bringing to the marketplace, and that you can offer to everyone out there. Will you get everyone? No, you don't need to have everyone either, because it's just not feasible, right? But 91 million people is a lot of people for all of us to go talk to, and they're waiting for us. So let's go back to this screen. I don't know if you want to take a snapshot of that, but that's pretty incredible with the bill negotiation with our advocacy program. So, yep, there, they just highlight that. It's a big one. Realities of healthcare from perspective of a business owner. So now let's talk about business owners. 100% of business owners agree offering healthcare benefits is vital to attract and retain employees. Unfortunately, it's also expensive, as we've talked about. You can see there's that $2,200, but Peter and Ashley were paying $2,800, and it's overwhelming. Many change their employees to 1099 to avoid it. True or not true? So one of the things to remember, business owners want to attract good employees, but they just can't afford to bring in healthcare. But now they can. And do you know how many employers are starting to look at this? I will tell you also, you want to talk to the independent business owners, like real estate brokers, real estate agents, right? Insurance brokers. Insurance brokers are coming on to offer impact because there's nothing out there like it to offer their clients. it's incredible. So, but if you think about, I walked into a real estate broker in the affluent area here in Carmel, and she didn't even have healthcare coverage. She was young in her 30s, and she was taking the chance, right? People do that because they don't want to spend the money on it. They're healthy, right? They're healthy. They haven't had any issues until you do. And then it's devastating, right? So we have that option where they can really find a better way and not pay so much for it. So let's go on to this next slide. So quotes for business, we do up to 49 employees or less. So you can hit a lot of businesses with this, right? A lot of small businesses don't even have anywhere close to 49 employees, but they're out there. And I know a one that I met with my new business owners in Las Vegas, and they said they have someone, in fact, I talked to his wife. She said they cover healthcare for their whole all their employees. That's a lot of money, but they're taking care of their employees. They're looking at this because it's going to do a lot for his business, and putting the bottom line. When you cut that bottom line, that makes a huge difference, and it can make or break a business. Average of 40 to 50% savings for their employees, and not all employees have to do it. Like, some of them can do it. Some of it's right for, some of them it's not right for. So it's not all or nothing. So this is a great one. And remember, when you submit a business quote, you're just submitting the business information. If you go to the business side of it and you do a quote, it says quote, right? You're just going to input some information about the business, and then the business department of Impact is going to reach out to your business owner or their office manager and talk to them about everything and go over everything and set up everything. They do it all for you, and then you just watch it happen. You just did the referral. It's incredible. No participant minimums and no contracts. Monthly they can do the ACH withdrawals and customize their statements, continue to support and add new members. All of that is available to the business owner. So let's talk about quotes for Medicare. Everybody know people who are on Medicare, right? So you have to have Medicare Parts A and B. And what it's pretty simple. There's no pre-ex, so it doesn't matter if they have anything. It doesn't matter what it is. There is no pre-existing condition clause for someone who is getting the secondary. Impact will be their secondary to their Medicare Parts A and B. Okay, they have a PRA of $1,000, no co-share, and it starts at around $100. So, example, my mom has been on Medicare for a long time. She has Blue Cross as their secondary. She was paying about $1,150 a quarter, which is about almost $400 a month. My mom is healthy. She rarely goes to the doctor for anything, and so she's been doing that for years. We priced it with Impact, and it's $140 a month. So is that better than almost $400 a month, right? So we have something to offer that for that secondary. And again, the biggest thing is to understand there's no pre-existing that matters. So it doesn't matter what they come to the table with. That's incredible to know as well. No discrimination there. So let me go share the screen. All right. If you have any questions on these, we'll answer those at the end. So compare the difference. You can see as I hit the thing that they come up, high monthly premiums, we save up to 30 to 70% savings per month, high deductible per family and member, and family. And us annual PRA starts at $2,500 per household. And you can see most people have to, and insurance have to take the higher deductible because the cost is astronomical. Must choose from a specified network, which is most insurances they have a specified network. We get to choose our physician and where we go. You're not stuck within a network. RX pricing, we have incredible RX pricing, and it's lower than most I've ever seen. And then you can see the co-pays and co-shares. We had that conversation, the difference of it stopping at 5,000 max. Extra cost for telehealth. I told you the bill about $900, right? And ours is $0. Okay. So there's a lot. Now look at this bottom one. Insurance will never cover migrants in the US. Mexico, Guatemala, and Canada with no social security number, we can help them. Yes, we can help them. That's phenomenal. So how many of them out there are looking for that need healthcare? A lot of them are, like in this area, they work in the fields and do things like that. And sometimes those business owners do supply healthcare, but then that's who I need to go talk to, right? So let's talk about the money a little bit. I'm almost done here. So I want you to see how impactful this can be to your residual income. So being a referral partner with Impact, which is being a business owner here in ACN, this is based on an average. If you look at the bottom here, it's based on a $400 a month at 40% commissionable, and that's about $160 that go into your commission. So you're going to have some individuals, you're going to have some families, you're going to have some businesses. So they took this average. So remember, this is an average. It could be more, it could be a little bit less, but this is what it looks like. You get 40% of that revenue into your commissionable revenue, and that's where that number is. So if you went out and got 25 Impact members, that would equal $550 to $800 a month in residual income. You personally having, because if you have 25 Impact, you're going to have 20% getting paid 20%. Okay. In most, yeah, you're going to get paid 20% because they're not any of them 1 point. Okay. So think about that. What do you have to have in the bank? I bet Mr. Thomas could tell us, percentage wise, which they don't pay high percentage in the bank to make that type of residual income every month. Most people don't have that kind of money. So you get 25 Impact members. That's crazy. Double it. You can see 1,600 to 2,000 residual a month. You get 50 Impact members, 100. Now, based on this scenario, right? 100 Impact members, not going to be hard to do, because I'm going to tell you, everybody's going to be start knocking on your door when they start hearing from someone who has it and their results and how great it is, right? So look at the numbers here. Now, what if you were building a team and they did the same thing and you make 4% override on all of that adding up? Jeff Weber talked about it today. It was huge numbers, huh, Catherine? Huge numbers. And the reason, I focus on this because we all know, every single one of us knows money doesn't buy happiness, but residual income gives you freedom to do what you want, when you want, to impact lives, to make a difference. For the what ifs, like in my life, losing my husband this last year, not prepared, if you're not prepared for it, I want everybody to be prepared, because going through what have gone through this last year, if a lot of people were in that situation, they wouldn't have the position that I have. And that's invaluable. It's a blessing, and you have a blessing in your hands. And with Impact, you can change a lot of lives. And some of them are going to say, hey, I want to be a referral partner. I don't want to just save the money. I want to get in this business for that. A lot of medical people, doctors, they're coming in this business and they're focused on Impact only because they see that there's such a gap that is missing, and Impact has filled that gap. And they're seeing it. Like my gal in Las Vegas, she's like, where has this been? Where has this been? We have these talks in our meetings with the doctors. She's going to nurse practitioner school. And she says, they've been looking for something like this. Nobody has come up with it. Well, it's here. We have it. So we just got to get out there and get the word out there, and talk Impact, and not only impact other lives, impact your own life. I can tell you it's Impact. I use it everywhere I go. You can use it for chiropractor as well, which most insurances don't cover that. They're talking even about using it with the holistic doctors who have licenses, because they're all about, Impact is all about preventative. What if they could cover your gym membership? I know someone asked that question in Nashville, right? Lee, he asked that because why not? If you're really using your gym membership to be healthy and stay healthy, that's what they want. If they can keep you out of the hospital, all power to you and to everybody else, right? So that is what Impact is all about. That's what I wanted to share with you guys tonight. I know Jabri and that organization out there were so excited when they got this information. And just get you can do what I'm doing. Take these slides and share it with people. And that's what I wanted to share with you guys tonight. That's Jabri wanted to bring this to you. I hope it brings you value. And if you have any questions, I'm here to answer any for you.